Welcome to Wellbeing Wednesdays, our virtual learning series bringing the best minds in healthcare to your digital doorstep. In this second episode, we will discuss workforce challenges, including the future of digital technology, workplace well-being, and recruiting and retention amid the COVID-19 pandemic. Bailey Bryant, editor of Behavioral Health Business, will moderate a candid and forward-looking discussion between our 5 panelists. Chuck Ingoglia, President and CEO of the National Council for Behavioral Health. Carolyn Petrick, Associate Executive Director for the Ability Network of Delaware. John Tassoni, VP of Operations for the Substance Use Mental Health Leadership Council of Rhode Island. Alyssa Harley, Director of People and Culture for Datus HR Cloud. And Bridget D. Johnson, Esquire, Executive Senior VP of Corporate Affairs at CarePlus, New Jersey. To start things off, here is your Wellbeing Wednesday moderator, Bailey Bryant.
Welcome, everyone. I'm Bailey Bryant with Behavioral Health Business. Thanks for joining us for our second Wellbeing Wednesday. Very exciting. Before we dive into the very exciting topic of workforce development, I want to give a big thank you to our panelists. Of course, we have Chuck Ingoglia, Bridget Johnson, Carolyn Petrick, John Tassoni, and Alyssa Harley. Thank you, guys, and I can't wait to hear your brilliant insights into some of the challenges in this space as well as the solutions. As we all know, workforce development represents an enormous challenge for behavioral health providers, even on a good day. One of the most significant problems in the space is finding and retaining enough qualified workers to keep up with the huge demand in behavioral health care. In an environment like the one we find ourselves in today, it becomes even more difficult, more frustrating, but arguably more important than ever. So, how do organizations that provide mental health and substance use treatment accomplish that? What concerns do they have, and what strategies can help? Let's find out. To begin, I want to establish a little bit of context and perhaps understand the scope of the problem a little bit better. Workforce development is a very broad issue, and it means different things to different people. So Chuck, for the sake of our conversation today, I wonder if you could help us define the problem by explaining the primary workforce development challenges facing organizations in this field, from recruitment and retention to training and more. What are the main issues? Let's talk about those, and then we'll move on to solutions later.
Well, of course, Bailey, and just want to say thank you for having me back for this second episode. It's great to be here. And before I talk about challenges, I do want to just say something up front, right? Which is, as I talk to our members around the country, I'm struck by a couple of things. What a great field this is. People have opportunities to help engage people sometimes at their worst times in their life, to give them effective care and support them in recovery. And that helps individuals, families, and communities. And I'm continually amazed by the dedication and energy that people bring to this work. And it is also true that we have some challenges in terms of workforce. And to just put it in a little bit of context, I know I sound like a broken record, but I like to remind people, this is not a behavioral health problem. This is a worldwide problem. The World Health Organization has made it very clear that there is a worldwide shortage of qualified healthcare professionals. And so we find ourselves in the midst of, many other parts of healthcare struggling to retain and recruit enough staff. Certainly, we have some particular challenges. The patchwork of regulatory and reimbursement systems that we have for mental health and substance use care in this country mean that there's huge variation in what types of insurance pay for what types of individuals to provide what kind of care. There's variation in terms of credentialing, and that all makes the business of behavioral health very complicated, trying to match folks. We have this other little problem that there just aren't enough of certain kinds of professionals. It's hard to have find child and adolescent psychiatrists or other professionals. There's huge variation in the way that peers are reimbursed and engaged. And then we have this other little issue that on the good side, people have recognized that behavioral health is really important. That means there's tremendous, much more competition for that same pool of staff. So that's my little sense of kind of where we are today and some of the challenges facing our field.
Yeah, I like that you call them little issues. It makes them seem more manageable that way. Alyssa, anything you'd like to add on that? Broadly speaking, why is workforce development complicated?
Yeah, absolutely. So it's complicated for a number of reasons. A lot of those are things that we can control, and a lot of those are unfortunately things that we can't. As we saw last year with the pandemic and a number of changes, it did provide some opportunities for us for evolving our telehealth, for example. That being said, it's a challenge because it's never going to be done. It's really a journey, and making sure that we're always staying on top of this and pivoting to reflect what's happening with our workforce and responding and ideally being proactive with our plans.
Definitely. So that's sort of the 1,000-foot view of these issues. Let's talk about what this all means in practice for behavioral health providers. First and foremost, we have to talk about recruitment and retention. John and Carolyn, I want to ask you to weigh in here because each of you has a valuable perspective there as we try to understand the impact that this issue has on individual organizations. What are you guys seeing at the state level, the city level, both in general and in the age of COVID? John, do you want to start?
Sure, I'll start. Thank you for having me come on today. I think one of the biggest challenges that Rhode Island has, and I'm sure it's throughout the country, is the restrictions on education, the education process as far as people getting into the behavioral health field, low wages, high college tuitions, and when they get out of college, the rates and Chuck hit on this a little bit, the rates are very low. It's been a long-standing problem here in Rhode Island. The rate issue, we've been fighting that since I've been involved in the Substance Use Mental Health Leadership Council. And the members are having a tough time retaining people because they can see that they can make much more money doing and other things in other areas. Like you can go to McDonald's and get $15 an hour, but you can't get $15 in the behavioral health area because the companies and the nonprofits can't afford to pay it because the rates are so low.
Yeah, definitely. Carolyn, what are you seeing?
Very similar situation here in Delaware. Delaware is a small state, just like Rhode Island. We fight for competition with surrounding states. You can get from Delaware to Pennsylvania or New Jersey or Maryland within 15 minutes at any end. And there's a lot of competition and there's a lot of burnout. This is a highly intense job and it's tiring. People don't enter this field because of the money, obviously. They enter it because of their passion for helping people. And what we find is that passion doesn't pay. And we have to reframe how we recruit and get people interested in this from an early age, and then expand the acceptance of the job, of the positions as careers, as healthcare professionals. And there's a lot of very unsexy things that go into that policy and advocacy, but it does boil down to being able to pay people what they are valued. And us here in Delaware, for our members, have found that a lot of it is also reframing how we recruit people. You can't say, come do this wonderful job, but oh, by the way, we're not going to pay you a livable salary. So how we reframe the recruiting process, how we provide those sort of HR supports to our members who are small nonprofit organizations. They're all incremental, tiny little things, but they all have to eventually add up to broadening the workforce, creating interest at an early age, and making sure people are committed, giving them the tools so that they can stay in the job long term.
Yeah, that leads me into my next. Go ahead, John.
No, I just wanted to jump in on that for 1 second. This is a headhunter haven right now. The headhunters are going into areas, and I can just tell you from my perspective here in Rhode Island, the young, the talented, the bright, the headhunters are coming in, taking them and telling them like they can go to New York or West and make a lot more money than they can here in Rhode Island, and they're taking it. And that moves the pool down so low where we're having a problem retaining people and getting people into the field.
Yeah. So now that we've identified those problems, Carolyn, you touched on a couple creative solutions that seem to be working. Curious if you could provide any more color on how you guys are finding success in recruiting and retaining workforce.
Well, a lot of an individual organization, so we're an association, so a lot of our members' individual successes have to do with also the culture that they create and making sure that the environment, that this harsh environment that they're asking people to come work in is supportive and inclusive and allows them growth potential, allows them support for the hard work that they do, and shows their value in multiple ways. Agencies have varying degrees of success. There is a lot of burnout right now. We have had members say that they have had direct care staff leave to go to construction because it's just easier than doing this direct care work. I think, again, that the more creative nonprofit agencies have to be, the harder it is to make the argument that they need the funding to follow it, but they still have to survive and they still have to compete with the Amazons, with large, big box stores. And one of the things we found that is very helpful is giving them tools that they might not have on their own, such as HR resources, on how to advertise successfully and recruit people in a way that they are tapping into a pool that they might not normally tap into.
Yeah.
And
John,
I look at it. Yeah,
Yeah,
I look at it from this perspective. The mandates that the states put on the workers to have college degrees, master's degrees, and when these kids are coming out of school with $200,000, $300,000 worth of debt, and they're only making $12, $13 an hour, the math doesn't add up. You know, they'll be living in their mother's basement and father's basements for years to come because we cannot afford to pay what we need to pay. Nationally, I think that the national people need to look at, and I'm not talking about Chuck, I'm talking globally, is the issue of scholarships for these kids. Give them some money back. Give them some incentive to get into behavioral health. When they look at the jobs, they look at the amount of money that they can make, it's a turnoff for these kids. I mean, I see it here in Rhode Island. I mean, we do have some free college appointments here in Rhode Island, but nationally, it's a burden on these poor kids that got to go to school with $200,000 or $300,000 worth of debt.
Yeah. Well, hopefully they're like me and they have student loans, but have made it out of their parents' basement. We're going to dig more into those financial problems, solutions a little bit later on. But for now, I wanted to turn to Bridget and ask, what about Care Plus? What are the common recruiting and retention pain points that you're seeing? How are you dealing with them? And that's generally and amid COVID.
Sure. So amongst my many duties here at Care Plus, HR is one of my direct reports. And what we're seeing, and I'll be concrete with it, we struggle with finding and retaining the licensed clinical social workers. And it's been an issue pre-COVID and even amid COVID. And what we did a number of years ago is we switched to what we call a per diem pool. So we had a per diem pool for our LCSW staff because we had a number of programs that required the licensed clinical social worker, but the programs themselves couldn't afford to hire a full-time person with benefits, et cetera. So we had switched to a per diem pool. And what we're finding now, especially amid COVID, is people want full-time jobs. They don't want the per diem jobs. And I pulled a report recently in the last 6 months, the turnover with this particular group is about 37%, which is higher than any other group that we have working here. So there's a pressure and a demand for services, especially now amidst COVID. We have a number of school-based programs, for examples, where the schools want the clinicians on site and available to deal with the children who are struggling in all sorts of cases. And again, struggling to find that licensed clinical social worker is a big, difficult issue for us. And I think the second category, or second and third, are finding psychiatry, adult and children. Sometimes I call the child psychiatrist a unicorn. In the world of mental health, when you're looking for staffing, there's a shortage, there's a demand. APNs as well. We're pulling more on our APNs to supplement not having the doctor, so having the psychiatrist serve as the collaborating physician for the APNs. But to find them are difficult. And in our area alone, we have at least 3 other mental health care agencies plus hospitals that are looking to fill APN positions. So, and then trying to compete with the salary that a hospital can offer. So concretely, those are some of the issues that we're seeing here.
Yeah. I know that you guys have all highlighted these issues, but they're not just issues for folks on this webinar. They're issues for everyone in the space. So I want to do a call out to attendees here. We're going to put a poll up on the screen, and we want to hear from you. So the question at hand is, does your organization have a strategy for recruitment and retention? Then the options here are: yes, this is a priority at our organization. Yes, but they don't work and we need to develop new strategies. No, we don't have the capacity to do this, even though we understand that it's important. Or no, we need more guidance and resources on this issue. So I'm going to give you guys a couple more seconds here to put in your answers, and then we'll see where everyone shakes out. It looks like so far, a lot of you are saying, yes, you have these strategies, but we need to develop some new ones. So I think that you're in the right place, because that's what we're doing here. So I think we can wrap up the poll now. Yes, the vast majority of you, 54%, said that you do have these strategies, but you need to work on new ones. 35 said, yes, this is a priority for our organization. And then a very small number of that they were worried about. So in that vein, let's continue to dig into strategies here and different topics of workforce development upon which we can improve. One criticism that the behavioral health industry has suffered in the past and currently is that there just aren't enough Black and Brown clinicians and providers in the space. With diversity, equity, and inclusion being a big goal for many organizations, and of course, with it being Black History Month, I want to talk about how we could start to fix that. First, question for Alyssa and Bridget. I want to ask each of you to address steps to recruiting and retaining quality and diverse staff. What are the best practices? Alyssa, do you want to kick it off?
Yeah, happy to. The first thing that I'll say is it's a mindset and it's a journey. So I think that some organizations, with things that happened over the summer, go, oh, we need to put this on our plan, checkbox. And it can't be that to truly be successful. So it's really important that you have that mindset that, just like all of workforce development, that this is going to be ever present in your planning. So, and I'm really glad that you said retention too, because it's not just enough that we recruit. We already know how hard it is to recruit qualified individuals into our organizations. The last thing that we want to do is lose them. So speaking to recruitment, There are a few best practices that we've found really successful at our organization. The first is reviewing your job descriptions. Subconsciously, I think we might use gendered tones, whether directly saying she or he, or using words that might appeal to more men than women. Another piece is looking at where you're recruiting from. So it's not, as we know, it's not just enough to put up a job post and hope that the right people apply. We need to reach out to sources and other recruiting channels that will help diversify our talent pool. So we've found success by partnering with our regional HBCUs and forming relationships with them and being able to recruit directly from there. And then, of course, once you invest in those employees and you bring them on, it's important that we retain them. And to do that, it's having development programs, it's connecting with them, understanding what their goals are as professionals. As Carolyn was mentioning earlier, financials may be limited, but there are things that we can do to create and foster a culture of acceptance and well-being, and taking interest in what we can provide for them from a career perspective. And the other piece is when positions do become available in the organization, look internally. Financials are challenging, and so we want to try and fill those positions as quickly as possible. And if you form those relationships with your team and you understand their career path, you might be able to fill that role quickly by promoting within. So I think that those are some of the things that we've had success with in being able to increase the diversity here and retain.
Yeah. Bridget, what's your take?
I think I just want to include, when we're talking about recruitment of people of color, minorities, don't forget the Asian community. In our area, we have a growing Asian community, and we know there's a stigma attached to seeking mental health care services in certain communities of color. So I just want to say that we need to include the Asian population when we're talking about from a Care Plus standpoint. With the killing of George Floyd, and Breonna Taylor, it started a movement here at our agency where we started with every Friday having a support group to discuss certain issues, right, that are affecting our communities. That turned into us forming a cultural diversity committee, which we recently renamed Inclusion, Diversity, Equity, and Action Committee. And during our sessions, listening to a number of staff, not just managers, but our line staff as well, we started talking about certain policies that we have in place that are not seeming inclusive, right? Seem bias or implied bias. And one thing, for example, was our dress code. So we started looking at our dress code. How could we change that? How could we make it more inclusive? What we also did, which grew out of this Friday meetings in the committee, is we started a subcommittee for HR within our diversity team, looking again at certain policies and processes that we have, job descriptions, how are they worded? What I'll say is that change is a work in progress here. I think we're starting off with a lot of training that we're doing, and now the discussion is to make certain training mandatory. How do people know that they're biased, right? Bias or prejudice, it's present, but not always conscious, right? That's implicit bias and easily to recognize. And we are looking at studies that are revealing students, nurses, police, even employment recruiters, hiring managers may exhibit implicit bias, but don't know it. And so what we're starting to do is not just train, but make the training mandatory. From an HR perspective, we're starting again to look at our job descriptions to see how they're worded. And I know it was mentioned about going to the HBCUs. For us, our HBCUs are farther out of the state, right? So we have one, the closest one I think is Lincoln University in Pennsylvania. So HR, we started the conversation of reaching out to the HBCUs that may not be in our area, but probably have students that are from New Jersey, and speaking to them, recruiting them to come back to New Jersey. We're talking about actually saying to some of our local colleges, we need minorities, and this is the reason why. And then really trying to solicit and advertise for minorities to come to Care Plus, and why. We're looking at maybe offering more supervision as a lure for those who have provisional licenses. So these are some of the things that we're trying to do to bring people in. But again, I'll say it's a work in progress. It's a learning for us because it's interesting. You don't know that you have these biases, right? Going through some of the training that we're doing, we're realizing it and saying, how can we make some changes?
Yeah, I think I'm glad you said it's a work in progress. That's all any of us can do right now is try to be better. So I really appreciate you both giving those actionable examples of how organizations are doing that. Presumably, making an organization more diverse would be good for everyone. Polls have shown that people of color seek mental health care treatment less often than others. One factor is that Black people want to see Black doctors, but that's not always easy to do. So presumably, organizations have an opportunity to address two problems at once here. By increasing their diversity in their workforce, they could also help to eliminate cultural barriers to access. John, Carolyn, love to hear your thoughts on that. Carolyn, you want to kick things off?
Sure. We're an association of nonprofit organizations. So we have members, all of our members have boards. I think it is important that not only organizationally, but at the board level, that leadership reflect the workforce as well. And if we're talking about trying to recruit a more diverse staff, then I think that starts with a more diverse leadership and have it be at that conscious level. One of the things we're trying to do here in Delaware is work at the certification level to have inclusivity training and cultural sensitivity training at the CEU level, so that as treatment providers are coming in and working on their licensure, that it's embedded from the beginning and then continually ongoing, and that those biases are chipped away generation by generation with each new leadership team that comes in, and certainly at the board level and at the peer level as well, making sure that it's not the same small group of people making these big decisions within the leadership, but that it's representative of everybody they're trying to recruit to work in that organization.
Yeah. John?
Well, I think that we need to do like professional sports does with the minor leagues, bringing people up through the organization, give them some monies, scholarships to go to school, further their education. There's a lot of online training now that we offer here in Rhode Island compared to what we used to do before. A lot of face-to-face. Now it's a lot of online training, so people don't have to worry about transportation, getting to our facility to take the classes. A lot of it's online. But again, I'll go back to it's a money issue. It's a money issue as far as education. The enormous amount of fees in college tuitions are killing our industry, because we have to spend so much money to get the minority community, whether it's inner city kids or others, to the college ranks to get these certifications and the master's degrees and everything. It's a perfect storm for the behavioral health industry right now. And there's got to be some monies freed up from the federal government to help these kids get some education and get them and steer them in to the behavioral health community.
Yeah, Chuck, you said we're working on that, right? Sorry.
Certainly, well, there's a couple things I want to say. So certainly we are working on loan repayment programs at the federal level, trying to get those expanded. There's the National Health Service Corps, and it's interesting. The largest group of professionals who are supported by that program are in behavioral health. We know, however, that program is limited. You have to be in a underserved area, and so there are additional programs that Congress has created that are beyond that, and we're working to get more money there. But gosh, this conversation is so rich. There's like a couple other things. Could I say one? I think, John, you raised a really good issue. Sometimes there are kind of regulatory requirements in terms of educational level, but sometimes we impose those. Like, we have assumptions about who can do what kind of jobs. And I know that's one of the issues that we're looking at even internally at the National Council is back to Alyssa's comment about job descriptions. Do we really need a certain educational level for people to do particular jobs, and how do we approach that? And the only other thing I wanted to make sure I said is I'd be remiss if I didn't say that the woman who wrote the book on implicit bias, Jennifer Everhart, is going to be at the National Council Conference in early March. And if you need some overview about not only what implicit bias is, how it operates, but also how you can address it in your own life, in your own organization, you want to make sure you come and listen to that.
Yeah. Bailey, can I just add one point? Yeah. Just wanted to add one point to what Carol was making about the leadership and where it starts, because I'll say at Care Plus, we did do a presentation, and we're doing more to our board. And one presentation that I made a few months ago was just giving them pie charts and showing them the number of, the percentages of minorities that are in our county, and then the percentages of our clients who are minorities, and saying to the board that we need to reflect the people that we're serving, right? And that has gotten so much, I'll say, traction, where at several of our board meetings, I'm now hearing them say, what does our diversity look like? And we have a number of other subsidiary corporations under us, but hearing the parent board say that we need to look at this more closely. And then when we're starting to get resumes, ask the question, are we all looking alike? I think it's critical. It gives support and credibility to what we're trying to do at the other level of the agency. So I think definitely buy-in at the board level is critical for change to really occur.
Yeah. And the numbers don't lie. I love the pie chart idea. That kind of brings us into the next poll question that we have here. Got to make sure the audience is still kicking. So we are going to have a question come up here on the screen. And the question that I want to pose to all of you guys in the audience is, what grade would you give your organization in terms of workforce diversity? Standard grading scale. So if you went to school, you'll see those there. But I think this is something that we're all working towards. So I don't think that there's any shame in admitting that you don't have an A+. I don't think anyone does. Seems like most of the respondents so far rate themselves somewhere in the B to C range. So definitely something that they're mindful of, but working on. Luckily, we only have a few Fs, so it seems like everybody is conscious of this and working towards it. So, okay, well, we'll go ahead and close those poll results. I'm glad you guys are still with us, paying attention. And let's move on to hiring and training. As if the behavioral workforce problems couldn't get any more difficult, you add a pandemic to the mix. It's totally revamped the workplace as well as the training and hiring process. So Chuck, before we talk about the role of virtual in hiring and training, are you seeing any interesting trends with respect to recruitment and recruiting virtually, and with respect to training?
Well, I think the interesting thing, Alyssa talked earlier about, telehealth and all of the advancements that have happened in telehealth. That's also come with it a lot of relaxation of licensure requirements across state lines. And I know, as our own organization, we're thinking about recruitment and retention, not just in our area, but can we go broader because of in a virtual world. So I think that is, something that works both ways, right? Because that also then feeds into, our staff are also much more attractive to other people who are providing virtual care. The other idea that I've thought about that I'd love to hear reactions from the audience is, I've been wondering about, industries that have been hard hit during the pandemic, like food service or retail. Do we have any opportunities to recruit from there especially for some of our lower level jobs, which don't require specialized licensure? And I got to imagine, I know I've had many a nice bartender who is really engaging, and we know that engagement is the most important thing in behavioral health. So I got to think there's some opportunities there as well.
Yeah,
I'll take a whack. I'll take a whack at that. Opportunities. It would be great if we had the opportunity, but we don't pay. I'm saying to generalize. I can just speak for Rhode Island because that's where I'm from. Again, minimum wage, they just passed the legislation. It'll be 3 years before it gets to $15. But McDonald's and the fast food places are already paying $15. So these poor kids, we can't relax the accreditation stuff in Rhode Island. We need to do that. We need to give people time to get to where they need to be in order to come up to where they need to be in order to do their jobs. Again, this is like a farm team issue. To start them on the bench, work their way to first base, second base, third base, and home. We need to figure out a way how we can use money into training, into retention. In Rhode Island right now, during the pandemic, our staffs in all 31 agencies that we represent are jumping for a quarter. They're jumping from one agency to another agency for 25 cents. Or the headhunters come in, scoop them out, $4, $5, $10 an hour more in other states. So that's where we're being liquidated by this perfect storm.
Has anyone else seen any recruitment opportunities from restaurants, bars, that sort of thing, in response to Chuck's question?
I think there's certainly opportunity there. There is, here in Delaware, our restaurant association as well as our construction field had shown in reports of overdoses to be higher in industry in incidences of substance use disorder and overdoses. So those two industries have been working with our state to help improve treatment access and treatment opportunities where they are. And we as an industry here in Delaware and those of us that are in the advocacy world have been pushing for more opportunities where treatment meets them, goes to where they are. I think that our field especially, people get invested in this because they have a direct experience. And if you can nurture that and show that there's a pathway to a career, that's a really wonderful, passionate pool to try to choose from. Certainly the industries themselves are hit hard. But I also think that you have to start the spark early on, and, tracks in the public school system or technical high schools, and having that be an option to start learning about various direct care industries that don't necessarily require advanced degrees to get started on, or at least to be in a professional position while you pursue your education. In the school district that my children go to, the public high school has various career tracks. They have engineering, they have culinary. It would be wonderful to see direct care, direct health care, education and involvement at the high school level and nurture them. And then in the meantime, all of us in policy can keep working and chipping away at those bigger financial issues, the bigger stigma and equity issues, working to make sure that if we're asking people to have LCSWs, if we're asking people to be clinical psychologists, that we're reimbursing them at a rate that's proportionate to their education, and not saying, well, if you're an MD, you can be reimbursed adequately for this service, but otherwise, if you're an LCSW, you can provide that same 1 hour's worth of service and only get $12 or only get $4. You have to create a career pathway if you're going to recruit for the immense need in this field.
Agreed.
Can I jump in on the building trades issue? I'll tell you, in Rhode Island, they've done a phenomenal job with the building trades. They have actually held a number of trainings, classes for the regular worker to look out for one another. Our building trades here was hit very hard with overdoses and overdose deaths. So the chairman of the building trades, Mike Sabatoni, took the bull by the horns, brought in all these experts, started training the business managers and the presidents of these unions and working their way down. And now they have peers in the field. So if someone has an issue, they can talk to someone. They give the peers, I believe, a little bit of extra money to do that work, but it's been saving a lot of lives here in Rhode Island.
Yeah. So going back to virtual care, Chuck, I wanted to ask what you're seeing among National Council members when it comes to interviewing, training, and other HR functions. Are they doing that via virtual platform? How's that working out?
Well, I think all of us have had to, any of us who run a business, right, have had to adjust. I know the National Council, for example, we've had a third of our workforce start since the beginning of the pandemic, and we're still completely virtual. So nobody has met anyone. No one has been to the office. And it's really forced us to rethink how we do onboarding. Well, first of all, recruitment, and then onboarding. And we've had to and then from there, supervision, right? All of it is, we just had a great discussion yesterday with all of our supervisory staff about how are they adjusting to this new environment. It's, the pandemic has an extra layer of self-care. We're all home with our kids and dogs and spouses. And I can speak from experience. That's sometimes stressful, and then you have work stress on top of that. So it's requiring really new skills. And I'm actually very intrigued to see how this continues post-pandemic, because it's really created a different kind of atmosphere. I know for example, we have developed or implemented a flex schedule, which we've never had before. Cognizant that people need, there are different stresses happening in their lives, and they're going to need flexibility. And I know as a leader, it's been really interesting for me. I think I have more contact with staff now than I did ever before. I am, texting with folks and, interacting with line staff in a way that I was never possible pre-COVID. And I'm just hoping that I can keep it up going into whenever we, quote unquote, return to normal.
We're all waiting for the day, Chuck. Let me know if you give me a chance. But that kind of brings me to my next question, which is resiliency. Wondering, I'll pose this question to the group, how employee resiliency is holding up during this time, and what effective strategies you guys have deployed or seen deployed to keep morale up. We touched a few different times on employee burnout. It's a very real thing in behavioral health on a good day, and now we have a pandemic. So I'll kind of open that question up to the floor and ask if anybody has any resiliency tips or insights.
I don't know if there are tips or insights, but I'll tag on to what Chuck was saying. From a provider perspective, we have emergency screening programs that run 24 hours. We have residential group homes and a number of other programs that may not be conducive to working from home. So technically, Care Plus, we never closed. We were always open, but we did switch to a work from home model. And over the summer, instead of 100% work from home, we then went to 25%, at least come in the office at least 25%, and allowed more flexibility. And we've kept that model since the summer. And I do think it is conducive to people that have children at home, that have virtual schooling. And I don't know if this is ever going to let up or if we can ever go back to what we had. So from our standpoint, what management is doing is really thinking about what happens after COVID when we have enough vaccinations, et cetera, and bringing people back into the office, if we ever will be. I think we may still be in some type of hybrid flexibility with the work schedule, which is very interesting. And what helps is the relaxation of the telehealth rules, right? Right, Chuck? And I know from our standpoint, we went maybe a year ago, 5 licenses. In the spring, we brought that up to 75 licenses, and right now we're at 195 telehealth licenses. Allowing that level of flexibility, not just for the staff, but also for the client, thinking about the client who also has children, who also has work and other demands, and allowing a level of flexibility. So I think flexibility and the ability to change and go with this particular flow is the challenge that we're facing, but we're trying to meet it.
Yeah. Anyone else have anything else brilliant to add?
Well, I don't know if it's brilliant, but I think that with the younger workforce, you have to give the younger workforce a little bit more flexibility, as Bridget said, because now we have kids at home. They have homeschooling. The 40-hour work week is not there anymore. Working from home is going to be probably, I would say, a good percentage of Rhode Islanders will be doing that. There's a lot of lease places up for lease because people have just shut down and they know that they can work from home. And I think that's the new norm. We'll be going into the office maybe once or not even have an office anymore. Everything will be done by emails, texts, or phone calls. But on the flip side of that, it's a little bit more difficult for our clients if we don't have a space where they can go and receive treatment. Not all of our clients have the capability to utilize technology. I mean, one of the projects I'm working on here in Rhode Island is to get some technology out to our providers so they can give them to their clients so they can have telemedicine visits from home. And I've been trying to advocate in the state of Rhode Island to have a mobile van to go into the low income areas so people can go to the van and have telehealth right in that van. I mean, obviously, there's privacy issues we need to work on, but you know what? It's a thought. You got to start thinking outside the box.
Yeah. Well, you're going to be excited because the next thing we have to talk about is financial issues. But before we get there, I have a poll question for the audience. So make sure everybody's still kicking. Look at the screen. We're going to have a question up there about resiliency during this time. Workers are under incredible strain. Is burnout a problem at your organization? And is enough being done to prevent and address burnout? So we've got the options there. It is an issue and it is being addressed. It is an issue and my organization could do more to address it. And it's not an issue either because my organization has addressed it or because we already took steps to ensure burnout would not be an issue. So it looks like a lot of people are grappling with employee burnout right now, understandably so. So it seems about 68% of folks say that. Another 28% say that it is an issue and it is being addressed. So that lucky 2%, though, is not having any problems. So thank you all for participating in that. Yes, Chuck?
So Bailey, for the people who are saying my organization could do much more to address it, I'm wondering if they wouldn't mind dropping some ideas in the comment in the chat so that we could capture those and see how we could try to advance that if people would be willing to do that. I really appreciate it.
Yeah. If anyone wants to put any questions or suggestions in the chat box, that would be great. You can do that on your screen. It should be near the bottom of your screen. So I'll let you guys do that. Don't know if we have fast typers out there. So in the meantime, I will move on to our next question here, which is John's going to be excited, like I said, about financial strains and financial issues. While we've been talking about workforce, the issues of recruitment, retention, and burnout, they really all come back to finances. Behavioral health providers are notoriously underpaid, both by commercial and federal payers, and that means slim margins for providers, low pay for clinicians, and now, amid the pandemic, it means some programs have even had to shut their doors. John, Carolyn, can you provide me some color on what you've seen in your state?
Well, I can tell you in Rhode Island State. Go ahead, Carolyn.
Thank you. Everybody that's watching this right now is well aware of the financial situation that behavioral health providers are in. I think, as somebody that, as an association executive, as somebody that works in policy and advocacy, I am ringing the rate increase bell all the time ad nauseum, to the point where it's almost, they see me coming and they say, yes, we know, Carolyn, increased rates. Yes, we understand. But I think that it bears coming at it from multiple angles. Increasing rates and increasing funding and getting it into the hands of providers and employers that they can then get it into, increasing the wages of their staff isn't as easy as just getting more money or applying for another federal grant or getting federal attention. It's breaking down barriers with payers, with insurers. It's stigma associated with actually getting the treatment. It takes generations of rethinking how we approach mental health, how we approach addiction, to seeing results. And I know that sounds not necessarily directly related to finances, but if you're talking about hiring a staff and being able to pay them a livable wage, then you have to be able to create mechanisms for which they can bill. You have to be able to know that your state agencies are negotiating the best rates possible with Medicaid organizations, or that they're implementing service structures and service systems that invite a robust and diverse provider pool, not just a diverse and robust workforce. And I think there's a multitude of ways, big and small, that state agencies that associations such as myself and the National Council and John can approach that, in addition to always ringing that rate bell, which I have no intention to stop ringing, but coming at it from multiple angles, I think, is the only way we're going to see real movement.
And I think from the federal level is going to take a look at some rules and regs that they need to take a look at. But given these states all this money, and that money that they give the states never makes its way down to the provider. Or a thorn in my side, it's been for many, many years, is the MCOs taking advertisements on race cars, soccer teams, stuff like that, where that money, I know they have to advertise a little bit, but the exorbitant amount of money that they spend in advertising could help us with wages, retention, and stuff like that. But the key is, and I've talking to the Rhode Island delegation about this, when you give the state X amount of dollars, only a small percentage of that makes its way down to the providers, because obviously they find other ways to put that money into the black hole. And that's not right. And our people suffer for that.
So John, John, you may have noticed that the last COVID bill that was passed by Congress did have a requirement that 50% of the special monies that were appropriated for mental health go directly to providers, and SAMHSA is working on how to operationalize that now. So I think some folks are listening. And I would say the other way that we've got to be thinking about this is systematically. I think one of the challenges we have in behavioral health is we don't have some of the same structures that the rest of healthcare has. And our efforts around certified community behavioral health clinics is trying to remedy that, right? We don't have a direct relationship right now with the federal government like most other kinds of healthcare providers do. So even if somebody wants to give you money, there's no easy way to do it. And, so SAMHSA has been trying for weeks now to figure out how to move this money because it's so different than how they usually approach disbursement. And this is also why we need sustained, adequate financing through Medicaid prospective payment. What we've seen in the CCBHC demo is if you can actually if you can pay competitive salaries, people will come work for you. And you have flexibility within your clinical teams to organize differently. And that has really made a difference. And I know, Bridget, you're a CCBHC. I don't know if you've noticed any of that in New Jersey.
I was going to say, while, I talked about some of the issues with hiring, especially the psych and the APN, being a CCBHC, having the demonstration, which was extended, and also having the expansion grants have helped us to be more competitive in the salary area with some of the licensed professionals. But I know a national council is doing tremendous advocacy to make this permanent. We talked about the demonstration and extension, and we're there, right, Chuck, almost every year, advocating for the extension and showing how this program can work. I'm glad that we're seeing more CCBHCs be created, but it's the expansion grant. We need permanent funding is really the advocacy. And I think that would turn into what Carol is saying about rates, changing the rates.
Yeah. Alyssa, I know that this is sort of an issue that DATAS has dug into. What does the data say?
Yeah, it is. So on an annual basis, we connect nationwide with leaders in the health and human services space. And year over year, financial sustainability is always towards the top. And unsurprisingly, over the last few years, it's been the number one issue. And then right below that is recruitment and retention. And so a lot of things that we're seeing is we know that we're operating on slim margins, but as you've heard today, recruitment and retention are number one. So what we're seeing with the providers that we partner with is they're getting creative. And you've heard a lot of examples today, and hopefully in the chat you've seen more, being able to offer flexible work schedules, work from home, anything that we can do to provide a better employment experience for our teammates will help, with that recruitment and retention. And a lot of things that we can do will actually have very little or minimal financial impact, especially when you consider the cost of turnover. And if we can reduce that turnover rate and keep that number lower, then that will be a cost savings in that way, and will certainly be a benefit for our employees and their development.
Yeah. Well, we are running out of time here today, folks, and I know we could talk about this for hours. That said, I want to give each of you about 30 seconds worth of time to share your final thoughts. What's your dream solution to the workforce development issue that organizations in the field are struggling with? Chuck, why don't you start? 30 seconds.
Well, I know we're looking at a number of issues to try to support, from loan repayment to apprenticeships to career impact bonds. But we want to hear from our members. What other ideas do you have that we should be paying attention to? We know this is number one for all of you, and we're continuing to try to figure out solutions. And let's not forget Medicare paying for LPCs and MFTs. Can never forget that one.
Okay. John.
I think it's scholarships, getting these kids the money that they need to go to school and get their licenses, and work retention. And I think the whole country will be better off if we can get something like this accomplished.
Carolyn.
I think that if there was consistency with what is expected of community level providers, they would be able to build their business plans and their budgets. I know that's not a very fun, splashy thing to say, but if they have something that they can rely on, that they know is coming down the pike, they can build their business plans and their budgets and allowing their model to open up and keep and retain their staff.
Yeah. Bridget.
I'm going to say all of the above, what everyone said. And I would say that National Council, for me personally, has turned me into more of an advocate. And I think we need definitely more advocacy on the federal and state level, especially even with our local legislators, to make some of the things that we pointed out a reality. And that's the difficult challenge. But I'm hoping other mental health care agencies, especially, we advocate for ourselves.
Alyssa?
Yeah, I agreed with everyone. Eliminating red tape will help us to do more and faster and be able to be more prepared for the challenges that we'll continue to face through 2021 and beyond.
Awesome. Well, unfortunately, that is all the time that we have today. So I want to say thank you again to all of our panelists and to all of our attendees. And in the words of Porky the Pig, that's all, folks. Have a great day, everyone.
Thank you.
Take care.
Thank you.